Hi, my name is Johan van Zyl and my channel is called JJ van Zyl Optometrist. And today we will be talking about vision loss and aging. I actually didn't write down the word aging because it's not a nice word actually. So yes, I'm a practicing and registered optometrist. I've been practicing for many years. I enjoy what I do. And people might even ask, why am I still practicing? I'm practicing because it keeps me humble. It keeps me humble looking at my patients, looking at some of the problems that they are encountering, and actually it makes me a little bit frightened as well. So today we will be talking about some complicated spectacle and health topics, and I will try to explain them in an easy to understand manner. If you're looking for some information, some basic information that will assist you in looking at what you can do to prevent vision loss if you are older, then please like and subscribe to my channel, JJ van Zyl Optometrists. Now, let's start with, what is vision loss? It is simply losing your vision. And when you get older, it can be very, very traumatic losing your vision. It is one of those senses that you use more and more as you get older. You certainly want to be looking after your vision. If you go blind when you get older, I can promise you it is not pleasant. But let's leave that for a moment and we're going to talk about what is it, who can it affect, when can this happen, why can you develop vision loss, what activities might place you under a larger risk of developing vision loss, and is it always permanent if you lose your vision? And most importantly, what steps can you take to actually try and prevent your vision loss as you get older? What is vision loss? It is simply losing your vision. And as I just said, it can be really very traumatic, frightening experience, especially if you lose your vision suddenly. But when can this happen? Now, it can happen suddenly. Most often it's actually a slow, gradual process. So you might lose vision in one eye. You might lose vision with both eyes. You might lose a part of one eye or a part of both eyes. You might lose your central vision, and you might even lose your peripheral vision. So vision loss is very often unique to you. And it can be quite a challenge to discover why is this happening. Now, who is at risk? And as I said right in the beginning, I didn't write down the word aging for a reason, simply because who is at risk? The biggest single risk factor for you losing your vision is getting older. And getting older can be quite a challenge on itself. So what happens when you start getting older? Most of us develop one or other type of systemic health problems. You don't ask for these things, they just seem to pop up. And as your eyes do not work on their own, they are part and parcel of your body. Your eyes do not work in isolation. Any type of blood pressure problems, sugar problems, stress events, or change in medication might affect your vision and actually predispose you to some vision loss, unfortunately. Some of the common reasons why you might develop vision loss include actually any event that might affect the structure of the eye, the blood flow of the eye, or the nerve supply. And as I mentioned previously, always remember, your eyes do not work independently from your body. Anything that is affecting your body, especially as you grow older, might affect your eyes and can then affect your vision. So what are some of the more common reasons why we might develop vision loss as we grow older? You might develop a retinal artery or a vein occlusion. Why might this happen? Any type of blood pressure problems. If you are diabetic, or you change your medication. Any medication that can even affect your blood thickness or thinness might actually cause retinal artery or vein occlusion. This is quite a common thing as you grow older. And also remember, as you grow older, your eye jelly inside your eye also is not as strong anymore. So a vitreous or a retinal detachment can also cause a vision loss, and sometimes it can cause a sudden vision loss, which we will talk about in a moment. So how does the vitreous, the eye jelly, actually affect the retina, and why would an eye jelly detachment actually cause a retinal detachment? Simply, when you are young, your eye jelly inside is very strong and it can handle any stress, it can handle any impact, it's got a high tensile strength. But as you grow older, the eye jelly starts to change. It starts to change from the inside. And from the inside, your eye jelly actually becomes a little bit more like water. It's not jelly any longer. So very often, a vitreous detachment is actually spontaneous as you grow older. It is a normal occurrence. And you might see some flashes or floaters. You might feel a little bit weird, but that is all normal. But sometimes it can be an abnormal occurrence. And you want to be able to distinguish what is normal and abnormal. And we will discuss that in a moment, how you can actually see if you have a problem or is it a real problem. We firstly going to do a demonstration and just give you some more information on actually how does the eye jelly affect or can affect the retina. Today we will be giving you a demonstration of actually what happens when you grow older, what happens to your eye jelly. I'm specifically talking about the jelly that's inside your eye, but myself and Michelle, we will be changing roles. I will be holding the young jelly in my hands, which is stable. If you look at this little yellow piece of paper, I can actually tilt this jelly. Now this is how your jelly looks inside your eye when you are young. Obviously it's not red, it's transparent, but it's strong. It's got impact resistance. The tensile strength is good. So if you have a shock, you have a fall, a bump in the head, the jelly is going to move, the eye inside will be stable because your eye jelly is strong. Now, this is what happens when your eyes are young. Let's have a look what happens to your eye jelly. Oh, there we go already. It's starting to fall out. So what happens when you grow older? The jelly on the outside part here, it can stick. But on the inside part, it becomes watery-like. So the eye jelly loses its impact resistance. If you have a fall or a bump, the eye jelly cannot absorb shock any longer. And what happens from the inside, it becomes more watery-like, whilst the outside part will still stick to the inside part of the eye, the retina. And if you have a jelly detachment, a vitreous detachment, it can cause the retina to also tear, and you can also develop then a retinal detachment. This is an ocular emergency. So if you are seeing flashes or floaters and you are at risk, please go and see your Eyecare practitioner, because look at the difference. It's stable. Don't try that, Michelle. So what activities actually might also predispose you to having a normal vitreous detachment or sometimes an abnormal vitreous detachment? So any fall that you might have, even a bump on the head, an accident, it can all affect your eye jelly, and the eye jelly can pull on the retina and cause a retinal tear or a retinal detachment. That can be a real traumatic event. And if you have sudden vision loss, if you are experiencing sudden vision loss currently, that is a medical emergency. You need to try and see your eye care practitioner as soon as possible. So let's start by assessing the severity. You have now discovered that you are having a problem. let's have a look at what we can do to discover a little bit more why this is happening and what you can do about it. We want to know, has this been a long time coming, or is it now suddenly? Just for a moment, think about what did you do prior to you actually losing your vision? Did you do anything wild and wonderful? Did you maybe change your medication? Were you very stressed? All of those things can affect you as you grow older. So just take a moment and sit down and just think about what happened just prior to me actually noticing that I've lost some vision. And then we're going to start doing our selfie eye test. As the name indicates, it's an eye test that you can do yourself. You can do it at any place, at home, at work, wherever you are, but you want to now try and see what's going on. You want to get some more information about how serious this vision loss is. And very simply, you want to cover one eye and look into the distance, look close, so make sure you cover all the distances, look in the distance, look close. Can you see with your open eye? Then change your eyes. Again, have a look in the distance, have a look close. Can both eyes see in the distance? Can both eyes see close? Are they pretty similar? If they can see similar and you can see, you might just have a visual field problem. It might be that your central vision is still fine, and you want to do a visual field test as well. And now, how do you do that? Very simply, you just look straight ahead the same way as you would look. And can you see my hands there? Can you see my hands there? You want to do it with each eye. Make sure you have, so your side vision is still there. Always note, when you are just thinking about what happened prior to you losing your vision, take a note of any pain or a sudden increase of awareness of your eyeballs. Because this, you need to communicate with your eye care practitioner if you have an eye care practitioner available. We are now going to explain to you the definitive test, a home-based test that you can do to determine some degree of how serious your vision loss is. And it's called the Pinhole eye test. And in the practice, we do this every day. It's very simply a black lens with a small little hole in the middle. It's called a pinhole lens. And all you need to do, if you cannot see that eye where you can't see, just close the one eye, look through the hole, hold it close, and can you see better looking through the hole? If you can see better through the hole, most often it is a glasses problem that you might now have discovered now. However, this is what we do when our patients phone us and they don't have something like that available. Use a black cap, make a small little hole in there, and hold the cap in this type of manner where you actually close the one eye and you look through the hole, not like this, but hold the hole closer to your eye. Make sure that there's no light coming in. And again, if you can see clearer through the little hole, then it is most likely that you are having a glasses problem, which is pretty good news, because then you can go see your optometrist, or you might have some time then to actually sort this problem out. If, however, you are not seeing clearer, it can indicate a more serious problem. And then you need to contact your eye care practitioner as soon as possible. And when you contact them, always take a note and explain to him, when did you notice this? What happened prior to you actually developing your vision loss? Did you change your medications? All those things will give your eye care practitioner some idea of what's going on with you. I hope you enjoyed this video and hope to see you again.